Something that happens at a lot of these summits is the sharing of our research, our evidence, our findings that we get through various studies and surveys. And something that I wanted to take a little twist on that and sort of show you some of the practical uses of your evidence that all of you are acquiring either anecdotally or through more research-based activities. So we're a big fan of evidence, and I'm going to talk a little bit about that today. So I want to start off by talking about the mission, because evidence is so important to the Health Initiative for Men that it's actually in our mission, and it's there twice. In the beginning of our mission, it talks about how we want to strengthen gay men's health and well-being through trusted, tailored, targeted, research-based health promotion, and that's a mouthful, but the key there is really the research-based, and of course by engaging communities through volunteer involvement, online access, and events. The second part of our mission that deals with research is that we we foster mutually beneficial relationships among gay men and health professionals to ensure the best possible outcomes. Now, our definition of health professionals actually includes researchers. So in the same way that we want to build the most beneficial relationship between a gay man and his doctor, we also want to build beneficial relationships between gay men and their researchers. We want to have a good relationship with the people who study us. And we do that through a number of ways that I'm actually going to talk about shortly. But why do we do these things? Well, we do them because we value the ability of gay men to make informed decisions. And in order to do that, gay men need evidence and research, and they need the most up-to-date information about epidemiological information, but also anecdotally through community-based research as well. So when gay men fully understand their options and the risk or lack thereof associated with them, then that's when we at HIM feel like we've done our job. We can't be there to hold a gay guy's hand and say, you have to use a condom, but we can certainly outline options and make sure that the risks are clear so that gay men can make informed decisions. We also see here that we value the role in of our community in supporting the foundations for healthy living, and again, we value scientific research. A lot of this is common sense. If you go to a funder with some ideas backed by some solid evidence, research, public opinion, you're going to have a much stronger case. And this rings true for speaking directly with gay men as well, not just funders. If you go to a gay guy and you have evidence to back your point, of course it's going to be a lot more convincing. So HIM is rooted in evidence, and it began actually before our mission was even fully articulated. There was a business plan that was submitted to Vancouver Coastal Health, and in that business plan, I actually pulled it out last week to look at the evidence that was cited, and of course one of the major sources of information was the Sex Now survey, and we've heard a lot about that over the last 2 days. The Sex Now survey is an invaluable tool that provides local gay information and increasingly national information on gay guys and their health. So other sources that we've used to justify HIM's existence include epidemiological data that said that gay men were having higher rates of HIV infection than other populations. And we combined this into a business plan. I've listed a few of the things that were in the business plan there. HIV transmission or transmissible behavior was on the rise. Testing was decreasing from 11% who hadn't tested, that had shifted to 18% over 4 years. Online hookups were increasing from 17% to 58%. So this is some of the data that we put into our business plan to convince funders that we were on the right track with HIM. Here, I included this slide. It's actually a slide that Carl developed for a presentation that he gave in Toronto, and it sort of outlines the vital role that the Gay Men's Health Summit played in creating knowledge, information, and evidence that we could then take to funders. So the Gay Men's Health Summit in 2005, 6, and 7 brought together community, researchers, health planners, and service delivery organizations to express a need for gay men's health organization. Now, we could have left it at that and said, okay, we've got some shocking stats that we put into a business plan, and now we've got our funders' money and we'll just do whatever we want. But that isn't the way we do things at HIM, and in fact, evidence impacts our programming significantly. A typical discussion about the type of programming at HIM will often include sentences like, but where's the evidence for this? And what does the research say? because without this we wouldn't be an evidence-based organization. So our groups that we host, one of our most popular groups is called Connect with Him. And Connect with Him is a group that brings together gay guys, both local and newcomers to the city, and it allows them to talk about whatever issues. It's a social group. But it's rooted in evidence that we have that newcomers to Vancouver, especially gay and other men who have sex with men, feel isolated. They don't have the opportunity to be social and reap the benefits of that. So we created a group, and it actually came from the community's need. Our social marketing campaigns. Each campaign has with it, when we create our creative brief, we put in a large section of data. The data will include things like risk, testing patterns, epidemiological data on various activities that gay men engage in. And we give this to our creative team, and really they kind of look at it and they're like, well, what do you expect us to do with this big bulk of stats? And we explain to them that we're trying to paint a picture for them because we want them to understand the situation as much as we do, or at least somewhat, so that when they're developing the campaign, they have those things in mind. The PEP position paper was born from anecdotal evidence. A street nurse actually approached us with some rather shocking stories about what was going on in Vancouver. And from there, we went out and we mined some data, and we found that there was a ton of international research and information about PEP and how it was efficacious and how it could be applied to reduce HIV transmission. So we put that into a paper, and then we started advocating locally for a PEP program. The second last point I have on there is mental and emotional health services. Again, the Sex Now survey gave us some data that said that gay men, not only were they accessing mental health services, they wanted to access more mental health services, and that they would actually come out to a community organization who offered those services. And the final point is our study participation, which we're involved in a number of studies. We were involved in Man Count. We're help with the Sex Now survey, but also we're involved with the acute HIV study, which is a study that's going on at the BC Centre for Excellence. There'll be a lot of data that will come out of that. And we're starting a project with Momentum through the BC Centre for Excellence, and Jamie Forrest, who is speaking. And we're looking forward to all of that because, again, we're creating a base, a wealth, I want to say like a tickle trunk of evidence that we can then dig out when necessary to develop our services so that they meet gay men's needs. So I do want to talk about some of the sources of data and evidence. So I mentioned the Sex Now surveys a couple of times. Of course, there are summits and conferences that we attend. Last week I attended one in Toronto. It was a Katie Knowledge Exchange, very informative. We do a number of lit reviews when new information is coming out and we want to know more about it. We'll send a team of researchers or RAs to do a lit review and then engage in knowledge exchange accordingly. Campaign evaluations. We don't just put out campaigns. Afterwards, we evaluate them. And we look at that information and then we apply it to future campaigns so that we can tailor them accordingly. There are local and national research studies. Of course, as I mentioned, Man Count, Momentum, etc. Our clinic questionnaire. Every client who comes through the Health Initiative for Men's Clinic actually has to complete, well, we ask them to complete a questionnaire. It gives us a number of demographic information, but also risk behaviors, and we find out what they actually came out for. What tests are popular? What are they interested in knowing more about? Volunteer engagement is another way that we stay involved with our community and also amount this sort of tickle trunk of evidence and data. And of course, community consultation, which is being presented in the other panel right now by Ian. That's something we've been able to do with Stop Funding. And it's a really interesting project. If you haven't heard about it, I suggest you go to our website and look at the community consultation. We sent out teams of guys to talk to people in parks and sex-based venues, bathhouses, to find out what their needs are. It's more of a needs assessment than a research project, but we're calling it a consultation. So I want to give you an example of evidence to action, and it's our condom distribution program, which was actually quickly followed by a condom campaign. So when I arrived in Vancouver, gay bars did not give out free condoms. In fact, Pump Jack, I believe, had a little basket, but other than that, there wasn't a place to access free condoms. And soon we started to look at local data that said that one of the reasons gay guys expressed for not using condoms was lack of access to them. So of course we thought, well, how easy would that be to try to fix that situation? So First of all, we had to design the dispensers, so we got a team of guys together from the community, and they put dispenser designs together, and then we got local bar owners to come out and create a dragon's den where they would judge the dispenser designs. So from the very beginning, we could have just went out and bought a dispenser and slapped it on a wall, but we said we want to make this about the community. We want community buy-in. And then after we built the dispensers, we got the bars and clubs and bathhouses on board. They all took them. We signed MOUs. They gave us access to fill these up. We sent a volunteer coordinator out in the community to solicit donations from local businesses for food so that we could feed volunteers every Monday night while they pack the thousands of condoms that get distributed. I believe last year it was something like 150,000 condoms were distributed to gay men in Vancouver. And the second approach that came out of that was we wanted to deal with access and make sure that gay guys had access, but we also wanted to do a campaign to follow up. And the campaign originally, the initial message was going to be peace of mind. So use a condom, peace of mind. And we got some man count data that said that gay guys were actually already on to condoms and knew that they were the best way to prevent HIV infection. But there were a number of other harm reduction activities that gay guys were engaging in already, things like serosorting, strategic positioning, withdrawal. And no one was talking about those particular things. So what we found was that while gay guys knew condoms were the best way, they also knew they weren't always necessary. And the problem is that they weren't sure when. So Do the Math attempted, and according to an evaluation, we think we succeeded, in having a frank conversation with gay guys about traditionally taboo topics like serosorting, strategic positioning, things that public health organizations or community organizations aren't necessarily supposed to talk about. So suddenly, use a condom, peace of mind, turned into not all sex has the same risk. A far more nuanced campaign, but also it was honest and it met guys where they were at. Some of the criticisms of the campaign that I heard immediately was it was too complex, it was too much information, and you shouldn't be giving guys an out. You should tell them it is condom every time. And I pointed to the data and I said it's simply not the case. We know gay men are already using harm reduction methods, and it's our obligation to give them as much information as possible. That said, I actually think Do the Math was a condom campaign. If you go to the website, every single page says the best way to prevent HIV infection is to use a condom. But then we acknowledge that that's not the only way and that guys are using other methods. So that was really important for us. And the evaluation, which was conducted by the Community-Based Research Center, had more than 900 men in Vancouver reply. I believe 300 and some from venues and 600 from the internet. And of course, we targeted places where guys would have seen the ads, so we took out ad space on Manhunt, so that's where we asked people to fill out the survey, or Squirt, or wherever we had done promotion rather. So of the 900 men who were surveyed, 47.7% recalled the campaign. And we were glowing about that. We thought that was amazing. Of those who recalled the campaign, the overwhelming majority, 82%, said that they had thought about their own HIV risk as a result of the campaign. Almost 60% learned new risk reduction strategies. 55% understood the message. And again, overwhelming majority felt that it was very important. Those who had seen the campaign were found to be more knowledgeable about HIV transmission. So I added this piece here because the evidence, it didn't stop once we produced the campaign. We acquired the evidence, we put it into a campaign, we put it out to gay men, but then we wanted to evaluate it to see whether or not it was effective. And now we'll use the evaluation data to make the next campaign even better. We have some ideas about who we would target according to the evaluation that was done and how we could do a better job of promoting that campaign. So I'm going to just go over one final slide, and this is our testing campaign. It began with the acute HIV study almost 2 years ago, and that was the What Are You Waiting For campaign. So What Are You Waiting For was the result of a partnership between him and the acute HIV study at the BC-CDC, and as part of their study they introduced NAT testing, or what we started to call the early test. And the early test was offered at select locations in Vancouver, but it was also being introduced at the same time that the rapid test was being introduced. So this obviously posed a bit of challenge. How do we promote both tests at the same time, but not confuse people? One's rapid, one's early. And in the end, we realized we didn't do that great of a job. Full disclosure. We put together What Are You Waiting For? And it was, again, a campaign that was simply about health communication. Diffusion of innovation was the model that was used, and the idea was to just get this information out to the community, and hopefully they would be able to respond accordingly. But we didn't leave it at that. So we put out What Are You Waiting For? And then shortly afterwards, again, the CBRC, the Community-Based Research Center, evaluated that campaign. And what they told us about the campaign was that we had done a really good job of promoting rapid testing, and that there was a lot of uptake, and guys liked that service, but they still didn't fully understand early testing, and maybe didn't see why it was for them, and the uptake was not as great. So we failed on the early test, we succeeded on the rapid test. So the subsequent campaign had to be about the early test and why it was important for gay guys to have this technology and also to use it. So we continued working with the acute HIV study to fine-tune our message, and the next campaign would focus on the early test and its benefits, picking up acute HIV, the benefit of the test being that it can detect acute HIV, whereas other tests cannot. Again, using a number of sources, we put together a data package, we attached it to our creative brief, and it included stats on risk, condom use, current testing patterns, reasons for getting tested, age variables. One of the things we found were that younger men were testing less frequently than older men. So we wanted to, again, target this campaign towards younger men, towards under 30. So all of the models used in the campaign were under 30. We bought advertising space in places where we felt that younger men would be congregating. And the hottest campaign had a simple message, especially compared to Do the Math, which seemed very complex, which was, if you fuck without condoms and aren't completely sure of your partner's status, get tested. It suggested that acute HIV was a powerhouse in the sack, and like a new relationship, hottest at the start. Now, of course, this campaign actually just ended, so we haven't done an evaluation yet to determine whether or not it had the impact that we had hoped. But anecdotally, I do some interviews for the acute HIV study, and one of the questions about that we give in the interview is whether or not people understand the early test and whether or not they understand acute HIV infection. And of the guys I've interviewed, the majority of them cite this campaign as having saw it. They may not know exactly what it was. They'll say something like, oh, it's hotter or whatever, but they can recall that this is a new piece of information that they acquired, and they acquired it from this campaign. So that's it for me, except I want to do a shameless plug, of course. We've just launched a new online testing service called What's Your Number? And it can be found at checkhimout.ca/testing. I would really love it if you got an opportunity to visit the site. I'm hoping that it's a tool that perhaps you can pass on to clients that you work with or friends. It brings together a number of technologies, including an email and text message reminder system for testing. So what happens is you can go to the site, there's a quiz you do, and you find out whether or not you should be tested every 3 months or every 12 months, depending on where you fit in the BC CDC guidelines. And then immediately afterwards, you can sign up for either an email or a text message reminder so that every 3 or 12 months you're reminded of that. There are other tools on the site, including partner notification technology so that you can let partners know about STIs. And there's also a risk assessment tool that was carried over from Do the Math. So, thank you.